Walnut Village residents, who of us could have ever predicted the length of time we would need to shelter in place and avoid physical contact with others? Who could have predicted the number of everyday life changes our Walnut Village would need to make to keep COVID-19 at bay? Who at this point knows all the sacrifice staff, family, and friends have had to make to keep our village safe? I'm so grateful for the hugely cooperative effort everyone is making as we close ranks in fighting this dangerous virus. I know that quarantine fatigue can strike each of us at any point and weaken your resolve to keep taking the preventive measures that are so necessary to save lives. But in the end, everything we ask you to do, every change you willingly make to your usual routines will make the difference for our community, as together, even when apart, we are thinking first of each other and how we might help in this epic struggle. In this short briefing, I want to make you aware of several key updates I believe are helpful for you to know. We're continuing to disinfect the entire community multiple times a day, as well as closely screen and monitor each employee on every shift. Temperatures are taken and symptoms are checked on each employee. Orange County has posted a guidance by the California Department of Public Health that states Californians who must leave their homes to conduct essential activities should wear face coverings and practice strict hand washing before and after touching and adjusting the covering. According to the county, utilizing face coverings can help reduce infectious particles from those who could be infected but are asymptomatic. It is not recommended for residents to use N95 or surgical masks, which should be reserved for healthcare workers and first responders. The county states that wearing a cloth face covering when leaving the house for essential activities may help reduce the spread of COVID-19 by residents who are positive but don't have any symptoms. However, it's important for community members to remember that face coverings are not a replacement for preventive measures like social and frequent hand washing, which continue to be the best way to protect yourself. We are delivering cloth masks to you today with cleaning instructions. If you're leaving your apartment for an essential activity, please be sure to wear your mask. Essential activities are essential medical appointments, short walk outside, walking your dog, or picking up your mail. A few rules about wearing masks. Don't wear the mask below your nose. Don't leave your chin exposed. Don't wear your mask loosely with gaps on the sides. Don't wear your mask so it covers just the tip of your nose. Don't push your mask under your chin to rest on your neck. Do wear your mask so it comes up all the way up, close to the bridge of your nose and all the way down your chin. Do your best to tighten the loops or ties so it's snug around your face without gaps. And we will be handing out these instructions to you with the masks. Starting today, all staff will be wearing disposable masks. And this is what the mask looks like. Outside visitors. I want to take this time to remind you how important it is that any family members refrain from entering Walnut Village property unless it is absolutely necessary to drop something off for you. If they are dropping something off, please do not meet them at the welcome desk. We want to minimize exposure. It needs to be done at the welcome desk, and we will get those belongings to you. I understand how difficult it must be to refrain from being with family members at this time. Everyone is being asked to make difficult choices right now, and if followed, will result in the outcomes we all want. Anything less could compromise our ability to keep you and all the residents at Walnut Village safe. Please adhere to the visitation policies and procedures we have in place. Thank you. Update on number of cases. We currently have no staff or resident cases of COVID-19 at Walnut Village. However, there are 1,016 cases in Orange County with 104 cases in Anaheim. There have been a total of 17 deaths in Orange County relating to COVID-19 as of April 8th. I have a couple of care center closure related topics to discuss. Questions, we had daily meetings regarding the closure of the care center, and there were some questions that were asked at those meetings that we did not answer. So we have reviewed the questions and have answers to all of them, and we'll be sending this information out to you next week right after the Easter holiday. We have also discussed partnerships with several skilled nursing facilities. Dr. Glasgow, our medical director for the care center, has recommended 3 5-star facilities for Walnut Village to partner with. We've had virtual meetings with 2 of the 3 facilities that he's recommended, and the leadership team of both facilities are very enthusiastic about the partnership with Walnut Village, and we'll send this information out to you next week after the Easter holiday. A couple of questions requested by residents. Number 1, is there a plan to have care center and independent living residents and/or staff tested for COVID-19? And will the Department of Health and Department of Social Services facilitate or require testing? The Centers for Disease Control has guidance for who should be tested, but decisions about testing are at the discretion of state and local health departments and/or individual clinicians. At this time, we do not have a plan or directive from either the health department or the Department of Social Services to test our residents or staff for COVID-19. Front Porch Executives, second question, Front Porch Executives were not able to address our questions about closing the care center. A major question that has not been answered is this: if we are admitted to a care center, our first 30 days are covered by Medicare. After that, depending upon a person's insurance, there may be private pay charges. If those charges are more than the 2020 rate that was being charged at Walnut Village Care Center and we are admitted in 2020, is there a clear differential which can be documented and understood by the patient and family? What happens in 2021 and beyond when there is no base rate for Walnut Village Care Center? How will the patient and family know what the differential is? The answer: the care center private pay rate calculation for any CCRC residents will continue to be maintained on file at Walnut Village and increased each year in accordance with the Front Porch Care Center rate increase, using the current Walnut Village Care Center 2020 private pay rates as the base rates. Copies of the current Walnut Village Care Center private pay rates are available upon request. Please let me know if you have any questions or topics you would like to hear about, and I will discuss them on future videos. I hope you're all staying well in your apartments and staying in your apartments as much as possible. Take care.